My name is Burton Carr. I'm a junior nursing student here to check you off on the ears, nose, and throat on September 29th.
Hi, my name is Brian Buchanan. I'm a Liberty nursing student. May I have you state your date of birth and name?
May 28th, 1993. My name is Rachel Dorman.
Okay, that's great, Miss Dorman. I'm going to go right ahead and assess you for your ears, nose, and throat. First, I've identified the ears. There's placement is proportionate, and they're fair distribution. They're symmetric with the head. Identifying the external structures of the ears. Notice that there are a few piercings on the helix. There's piercing on the tragus as well. Other structures such as the anatragus, scapula concha, inner and external triangular fossas are intact, no cauliflowering. Next, I would palpate against the patient's ears. No pain or tenderness noted. Otherwise, if there was, it would be presenting otitis externa. Okay. Next, I will be I'll be inspecting the internal canal along with the tympanic membrane. Bilaterally assessed. In the patient's findings, I've concluded that the patient's internal canal, ear canal, was fairly pink, swimming fairly distributed, and hair production is fair. Normal findings, of course, absence of draining. When coming across the tympanic membrane, the shape and color was round, pearly gray. Noticing internal structures of the membrane, the umbo, the handle of the malleus, conal light was pointing at 5 o'clock, and pars placida was superiorly proportioned, while the pars tensa was inferiorly proportioned, bilaterally assessed, of course. Moving out and assessing the patient's vestibulocochlear along with acoustic CN8 nerves, I will be performing a whisper test. This is assessing for gross hearing. The patient will cover one side of the ear, the left ear, while I assess the right side. And in this test, you will reciprocate the words that I say while I cover my head. Liberty Nursing.
Liberty Nursing.
Brian Buchanan.
Brian Buchanan.
Allison.
Allison.
Purple Shorts.
Purple Shorts.
This is bilaterally assessed. The passing rate is 50%, so the patient is well over and exceeding the passing rate. The right ear is intact, and I will go ahead and do the left. Next, I will perform the Weber test. By stroking this is assessing for bone conduction. I'll place the handle on top of the patient's head, the center point. Ms. Dorman, you're just going to note when you stop hearing it, and then when you start, whether you hear it in better the sound in both ears, the right ear or the left ear. Okay. Okay, the patient's normal finding is both ears. If the patient had happened to have heard it better in the right ear, we would occlude that side, and we would perform the same test again. And the expected finding is that the patient would hear better in the right side of the occluded ear because we are eliminating the factor of air conduction. Moving on to the Rhine test, I'm going to be placing this on the mastoid process. You're going to let me know when you stop hearing it, and then I'm going to move on to placing 1 inch away from the external canal. Okay. Okay, the ratio was 7 seconds plus air conduction, which was 21 seconds. We conclude that this is a ratio of 3 to 1. Normal finding, passing rate is 2 to 1, so the patient's right ear is intact. This is bilaterally assessed, so I would go ahead and do this on the other side as well. Okay, the Rhine test has been assessed for bone conduction and air conduction. Moving on to the nose. I notice that the ridge is fair. Any kind of tenderness?
No.
No. Okay. Okay, I've concluded that the nostrils are oval. There's presence of nasal flaring. Moving on into the internal structures of the nose, hair production is evident, and no signs of drainage or unfamiliar exudate. I visualized the anterior posterior chambers. They were intact. There's few vesseling and no absence of peripheral deviation of the nasal septum. Moving on to the testing the olfactory nerve, cranial nerve number 1. Patient will close her eyes and occlude one nostril. Tell me what this smells like.
Cinnamon.
Okay. This is bilaterally assessed as well. Olfactory nerve is intact. Moving on to the mouth. I place the glove in the dominant hand. While the light source is on the non-dominant hand. Okay. Okay, and using a tongue depressor as well. Okay. I noticed that the lips are circummoral. No lesions, bumps, lumps, cracking in the little corners. Show me your teeth. Okay. Teeth are white. No, and I would palpate. Open your mouth. Okay. No tenderness, no pain noted on the patient's against the patient's teeth. All teeth are aligned. Gingiva happen to be fairly moist and pink in color, no lesions. And assessing the patient's buccal membranes. Okay. And stents and ducts are palpated. Bilaterally assessed. Okay, they're assessed for lesions, bumps, not noted, and buccal membranes happen to be pink in color, no tenderness, no scarring lesions as well. And next I'll be assessing the patient's tongue by getting a hold of the lateral borders. Okay, just stick your tongue out. Okay. Lateral borders seem to be intact. They're smooth. Papillae were pink in color, and I felt for the hard palate, and the ridge was presentable. Also, I noticed for the anterior posterior pillars, the tonsils were intact, and the patient's tonsils were no obstruction, no exudate, grade level less than 1+, of course. And testing for the hypoglossal nerve, cranial nerve number 12, I would have the patient be stick your tongue out and move it side to side. That nerve's intact. Moving on to the vagus nerve, cranial nerve number 10, I would have the patient. I would perform a gag reflex. I would place the tongue depressor against the back of the person's tonsils, and if they gag, that would be the cranial nerve number 10 finding. Cranial nerve number 9 is responsible for talking and swallowing. Patient's already been talking, and swallowing. I would just open your mouth, swallow, without. All right. I noticed that soft palate rose and deviated as the patient swallowed. And that was cranial nerve number 9, happens to be glossopharyngeal. And that concludes the assessment.